Hello, Namaskar, and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals to this live show. In this 1 hour, you can ask your queries and questions in the live show, and we shall place these questions before our expert and bring you an answer. And this is going to be a telecast on social media of Apollo 24/7, that is Instagram, Facebook, and YouTube as well. But if you have a question, you can watch this anywhere, but if you have a question to place before our expert today, we request you to hop on to YouTube chat. There, I request you all to type your questions, and whenever you type your question, I request everybody to mention their age, gender, and all other medical data or history that is pertinent to the question that you're going to ask, so that it's easy for the expert to answer your question. And also on this show, we do give away a lot of gift vouchers and discount codes that you can use on Apollo 24/7. And also there's a health quiz where you can win prizes from Apollo 24/7. I urge you to download Apollo 24/7 app, which brings the entire facility of Apollo hospitals just to the power of into your hands, and you can utilize them to buy medicines, to book lab tests, or even to consult experts. तो चलिए आज का टॉपिक हम बात करते हैं. टुडे वी आर गोइंग टू टॉक अबाउट अ वेरी 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 इंपॉर्टेंट टॉपिक. दिस इज हार्मोनल imbalance. What are the signs and what are the diagnoses and how do we treat them? Today we are going to have an expert endocrinologist, Dr. Ravi Kant Saraogi, who's going to join us from Apollo Multispeciality Hospitals, Kolkata. So with his 20 years of experience, he specializes in the treatment of thyroid, diabetes, obesity, PCOS, osteoporosis, short stature, and diabetic foot as well. And so has been invited as a speaker and chairperson in different scientific forums across the country and nationally and internationally as well. And he has 12 publications in national and international journals. He's a member of Diabetes India Society, Indian College of Physicians, American College of Endocrinologists, and he has 12 publications, as I mentioned before. And he's been the past national executive member of Diabetic Food Society of India as well. So here we welcome Dr. Ravi Kant Saraogi ji onto the show. Namaskar, doctor. Welcome to the show.
Good morning. Yeah.
It's an honor to have you here on this show, doctor. And this is one topic
We
that
also,
I've been waiting to talk to a specific specialist. Uh, Men and women, children and seniors, it's very important to understand what hormones are doing to us. So I know that you are an endocrinologist with so much of speciality included in your experience. But one जनरल अंडरस्टैंडिंग कि हॉर्मोन्स क्या करते हैं और बचपन से लेकर सीनियरिटी तक इनका रोल क्या होता है.
yeah, very good question. Hormones basically regulate the body metabolism. Okay.
जी.
So, केमिकल क्रियाएं जो एंडोक्रिन मैंने अपने हिंदी में अगर वर्ड यूज करें तो रासायनिक क्रियाओं को मेंटेन करते हैं और बॉडी मेटाबॉलिज्म सही रहने से आपके जैसे पीरियड्स रेगुलर, हाइट रेगुलर, बॉडी ग्रोथ ठीक से होता है. तो अभी क्या है कि कॉमनेस्ट अभी most common cause of hormonal imbalance nowadays is change in the biological clock. Nowadays, the children are sleeping late and
जी.
waking up late in the morning. So they are disturbing the biological clock also, and they don't play in the sun, and they are always in the artificial light. So nowadays, like problems like diabetes, the hormonal thyroid disorder, polycystic ovary, these problems are increasing. So we have to
जी.
go back to our previous lifestyle, and we need to sleep early and wake up early so that we don't disturb the biological clock. And too much of mobile watching and other things, we need to curtain down certain things. Then only we can have a good hormonal balance also. Yeah, and you need to have
जी.
a good sleep, avoid stress, play regularly. These are the eat a healthy, nutritious diet. So these are the things we need to keep in mind.
तो मैं बेसिक क्वेश्चन में ये करना चाहती हूँ कि जब हम लोग बोलते हैं कि हार्मोनल इम्बैलेंस है, तो फर्स्ट एंड फॉरमोस्ट हमें सुनाई देता है कि हार्मोनल बोले तो थायराइड है. उसके बाद में डायबिटीज भी सुनाई देता है. इनके अलावा जो ज़्यादा लोगों को ये लगता है कि थायराइड है और डायबिटीज है, इंडिया बिकम दी लार्जर पॉपुलेशन, डायबिटीज पॉपुलेशन भी है, थायराइड पॉपुलेशन भी है. और क्या क्या है सर जो हार्मोनल इम्बैलेंस को सूचित करता है?
Yeah. बेसिकली जैसे आपके कोलेस्ट्रॉल इम्बैलेंस, हाँ, तो अगर कोलेस्ट्रॉल हाई है तो बिकॉज ऑफ हाई ब्लड शुगर कैन लीड टू poor cholesterol, also bad cholesterol. High thyroid can also lead to, if you have a cholesterol abnormality, so you need to first control your blood sugar and thyroid. Then only you will be then only you treat the dyslipidemia, the like lipid abnormality. Then other abnormalities can be in the form of pigmentation, skin pigmentation, dry skin, or skin abnormalities can be there because of the whole, like hypothyroidism patients have dry skin. And other like eye signs might be present in thyroid disorders like protrusion of the eyeball and hair
हाँ.
loss, menstrual irregularity, depression can be a form feature of hypothyroidism. So everything is interrelated. So that's what I wanted to tell you. Okay.
Right. So, before I start asking you questions from our audience, one sincere request to all the audience who are watching this show. आप जो questions पूछ रहे हैं जी, I can see Mahesh, Tekeshwar, Jyoti, Certified, Bhavna. A lot of people have already joined and asked their questions. May I request you all to type down your age, your gender, and all other details. For example, Jyoti, you're asking about your HbA1c, जो आपका एज चाहिए, जेंडर चाहिए, आप ऑलरेडी डायबिटिक हो या नहीं हो, ये भी चाहिए. तो इट विल हेल्प मी टू पुट ऑल योर क्वेश्चंस टुगेदर. आई रिक्वेस्ट यू टू प्लीज रीटाइप योर क्वेश्चंस बिफोर आई प्लेस देम बिफोर द एक्सपर्ट. डॉक्टर, वन क्वेश्चन, क्विक क्वेश्चन डॉक्टर रविकांत, कि बच्चों में अगर कोई प्रॉब्लम होता है तो हार्मोनल इम्बैलेंस होता है, जैसे थायराइड होता है या कुछ और मेटाबॉलिक इश्यू होता है, तो उनमें क्या प्रॉब्लम हो सकती है बढ़ते बढ़ते?
Like most common cause in children nowadays is thyroid disorder, and some children might complain of short stature also. So thyroid
हाइट
disorder,
में.
so you need height issue, yeah. So you need to measure the pediatrician should always, whenever you visit a pediatrician, ask them to maintain a growth chart so that they
जी.
check the weight, they check the height. So because if you catch them early, then you can have a good response with treatment. Like if the patient is growth hormone deficient, then you treat early before 10 years or before 12 years of age, then you can have a good height because parents are worried about the height also. Then
जी.
hypothyroid patients, like the child is not growing properly, and basically child is sluggish in the class, not paying proper attention, not studying, not performing well in the school. So these are the things you need to keep in mind. And if you have a family history, like mother or parents or mother or father is hypothyroid, then you need to screen earlier so that you, so nowadays we screen at birth also. So
हाँ हाँ.
TSH should, at least you can do one hormone test like TSH, which can help you in diagnosis whether the child is hypothyroid or not. So that is there.
सर, ये बहुत ही इम्पोर्टेंट बात बोली है हमने कि आपने कि जो स्क्रीनिंग करना चाहिए हमें, तो ये मेटाबॉलिक
Screen.
डिसऑर्डर्स के अगेंस्ट अगर कुछ स्क्रीनिंग करना है तो क्या क्या ध्यान में रखना चाहिए? जैसे आपने बोला कि पेरेंट्स को अगर थायराइड है या डायबिटीज है, कब शुरू करना है स्क्रीनिंग? इफ माई बोथ माई
Parents,
पेरेंट्स. हाँ,
yeah.
प्लीज
पेरेंट्स
कंटिन्यू.
अगर थायराइड है तो हाइपोथायराइड या थायराइड डिसऑर्डर से सफर करते हैं, तो आप एट प्रेजेंटेशन माने विद इन 1 month ऑफ birth you can screen them, and every year you can screen them because hypothyroidism increases with age. So if you have a normal thyroid at beginning, then you can increase the interval of screening, okay, like 2 or 3 years. But if you have an abnormality, then you need to do screening frequently. And even then some people do not have family history, like we are getting diabetes at an age of around 10, type 2 diabetes at an age of around 10 to 20 years. Initially we didn't used to get. So now you can understand the burden of type 2 diabetes. We previously used to think only type 1 diabetes begins in childhood, not type 2 diabetes. But because of the western diet and lifestyle, nowadays we are getting type 2 diabetes even in age group between 10 to 20 years, school age group, adolescent. So we need to
That is shocking.
screen them, yeah, even the patient, because if the patient has pigmentation in the neck or skin tag or obese, then you need to screen them early in the school, like with a simple blood sugar, fasting blood sugar, or a random blood sugar. And if it is high, then you can go for further screening. Yeah.
Wonderful. So thank you so much. And about adults, अगर समझिए किसी का ऑलरेडी व्हाट आर द साइंस, पहले थायराइड के बारे में शुरू कर लेते हैं सर, क्योंकि डायबिटीज अगर शुरू करते हैं तो काफी लंबा चैप्टर हो जाएगा। तो क्या मॉनिटर करना चाहिए, गेटवे टू अंडरस्टैंडिंग थायराइड हेल्थ, साइंस क्या होते हैं, स्लगिश है या हाइपर एक्टिव है, क्या साइंस होते हैं?
Then patient might be asymptomatic also. Okay, so
अच्छा।
50% patients are asymptomatic, and they might have other features or other features like dry skin, menstrual irregularity, reproductive age group में infertility हो सकता है, weight gain हो सकता है, difficulty in hearing हो सकता है. So these are the things you can have. Yeah.
ओके। एंड व्हेन डज वन स्टार्ट टू स्क्रीन, अगर
In elderly patient, you can have constipation also. In elderly
ओ
patient, you can have constipation,
ओके।
sluggish bowel.
तो
Yeah.
पहले एक बेसिक टेस्ट क्या होते हैं थायराइड के फंक्शन को समझने के लिए, किस किस को एडवांस्ड एंड अदर टेस्ट करवाने हैं या किसको बेसिक करवाना है?
अगर एक सिंगल टेस्ट करना है तो यू कैन डू अ TSH because mostly 95% cases are primary hypothyroidism where there is abnormality in the thyroid disorder. But if the patient can afford, you can go for T3, T4 and TSH. And if something is abnormal, if any report is abnormal, then you go for further tests like anti-TPO antibody, ultrasound of the thyroid. So these are further tests you require depending on your screening abnormality. That's it.
सो यहाँ बहुत ही एक ज़रूरी बात मुझे आपसे पूछनी है और आपकी सलाह भी लेनी है। आई माई सेल्फ हैव बीन डायग्नोस्ड विद thyroid imbalance for a very long time now. I think it's more than 25 years that I've been taking Thyronorm. But I visit my endocrinologist every 6 to 8 months. So why is it important to keep a check, and how frequently do you visit an endocrinologist or a general medicine, internal medicine, and कब कब टेस्ट करवाना पड़ता है?
Very good question. If you are already receiving treatment and if you are not in the growing age, like 18 to 45 years, you can have an annual visit if your dose is finalized. But if your dose, like if you are in a growing age and if you are pregnant, if you have a comorbidities, if you are elderly, then you might need a dose change. Then you need every 3 to 6 months visit to your endocrinologist. But if you have a normal lifestyle, no frequent dose changing, you are maintaining an ideal body weight, then you can go for annual testing. And if you're already receiving treatment, you can simply do a TSH. And if you have a borderline thyroid abnormality, then you go for free T4 and TSH. That will help you. During pregnancy, we suggest free T4 and free T3 to add, and otherwise you can go for TSH only will do. And
Right.
one more important thing you must remember that during pregnancy, one should not stop the taking thyroid medication because it does not affect the child, and you might need to increase the dose. So you need to consult your doctor. Your dose might be increased by 25 to 30% also.
जी, तो ये बहुत ही इम्पोर्टेंट सूचना है कि अगर आप प्रेग्नेंट हो, तो अगर आपका ऑलरेडी थायराइड मेडिकेशन चल रहा है, सपोर्टिव मेडिसिन चल रहा है, तो आपको वो बंद नहीं करनी चाहिए। और हालांकि आप, अगर आपके डॉक्टर ने बताया है डोसेज इंक्रीज करना है, तो ज़रूर कीजिएगा, बच्चा हेल्दी रहेगा, नहीं तो प्रॉब्लम्स हो सकते हैं। दिस इज व्हाट डॉक्टर रविकांत जी हैज सेड। सर, फर्स्ट क्वेश्चन दैट आई वुड वांट टू टेक इज मिस्टर टेकेश्वर Kunjimbam. Inka Tekeshwar Kunjimbam. I'm sorry if I mispronounced your name, Mr. Tekeshwar. Sir, he is 60-year-old, male, non-diabetic. I happened to be suffering from hypothyroidism some 15 years ago. But now when testing, I turned out hypothyroidism 5 years ago and taking Tylenol 100. How it changes? तो मुझे ये समझ में नहीं आया पहले कि ये सोचते थे कि 15 साल पहले उनको था और गायब हो गया, फिर वापस आ गया। सर, ऐसा हो सकता है क्या कि एक बार आपका थायराइड इम्बैलेंस में, फिर वो सही हो गया, फिर वो इम्बैलेंस में चला गया? डू वी बिलीव दैट, और
Yeah,
इज
it can happen. There can be some lab error also, or the patient might be getting some medications also. As far as my knowledge, I heard that the patient was initially hyperthyroid. You said no,
यस सर, हाइपरथायरॉइडिक 15 years ago.
hyper.
हाइपर
Initially, he was hyper.
हाइपर
Okay, and now he is hypothyroid, you said.
Hypo. Yes.
Oh, yeah. So what I would
तो
say that ask
एक
him,
60-year-old है
yeah,
सर, नॉन डायबिटिक है.
yeah, it can happen. He might have received a radioiodine treatment for hyperthyroidism, hyper, and that might lead to hypothyroidism in the long term, which is the goal of the treatment. So whether we need to ask the person that whether he has received any treatment for hyperthyroidism, and there is a condition where your blood sugar level thyroid level can fluctuate. So you might be initially hyper, in the long term you might turn into hypothyroidism. So that can happen because of the TSH receptor stimulating and blocking antibody. So you need to do a further test, and you need to check the whether there is some antibody there. You need to take a proper history whether the patient received the radioiodine treatment or any other treatment for hyperthyroidism or not.
Right, right. So next question is Mr. Mahesh's question. मेल है, 30-year-old है, हाइट इनका 5'11" है, वेट है 70 kilos. I look like a 20-year-old, but I am 30-year-old. Hormone profile, LSH, FH, testosterone is normal. Any other specific test to be taken, because he feels that he is not growing according to his age.
Okay. And whether he has done sexual hormone tests like LH, FSH, and this
Yes, doctor.
testosterone?
Yes, doctor. LSH, FH, and testosterone are normal.
Normal. So sometimes it happens that you're less androgen sensitive. So you might not have the secondary sexual character might not develop well. So that is a normal finding. So you don't need to do anything because if androgen replacement might lead to some complications also in the person who is already having normal say, LHFSH and testosterone. So we won't ask him to replace androgen replacement, but he need to consult an endocrinologist for further evaluation. But this is a normal finding that some patients do not develop adequate birth and miscarriage. So that might happen.
Right, right. Sir, this is another interesting question. Sir, I'm suffering from hormonal imbalance. Can you suggest lifestyle changes to bring it under control? तो इंटरेस्टिंग इसलिए बोला है कि उन्होंने कुछ बोला नहीं है, बट लाइफस्टाइल चेंजेस के बारे में पूछा है, इसलिए इंटरेस्टिंग है. क्या ऐसी लाइफस्टाइल हमारी है जो हार्मोनल इम्बैलेंस तक लेके जाती है, और क्या हम कर सकते हैं लाइफस्टाइल मॉडिफिकेशंस टू ब्रिंग इट बैक, and will lifestyle alone help me get back to a hormonal balance state?
So first, I would suggest him to go for a checkup, like executive blood checkup, where you can do the all hormonal test. Where because he's saying that he's having hormonal
So she
imbalance,
is 80
but you
year
need
old Manasa, 18-year-old
female.
female Manasa,
If-
yes.
Okay. So if she's thinking that she might have some hormonal imbalance, then she need to at least do a thyroid test and other relevant tests like hemoglobin and blood sugar and other tests she need to evaluate. If she doesn't want to evaluate, only do the lifestyle changes, then we need to take care of her family history also, and whether we can ask her to have adequate good nutrition, healthy sleep habit, and do some sort of exercise regularly, and be positive, always think positive. That will also help her to
जी, जी.
maintain
सर, यहाँ
lifestyle.
पे लाइफस्टाइल के बारे में आप जो बता रहे थे कि हम लोग सही सोते नहीं हैं और गैजेट्स के सामने इतना बैठ जाते हैं, जो काम बोलिए या पढ़ाई बोलिए या कुछ एंटरटेनमेंट बोलिए, गैजेट तो लाइफस्टाइल ही बन गया है सर, which does not
Hmm.
allow us for enough physical movement or stimulation physically. So how important is sleep for a hormonal balance?
So you should restrict your screen time. You should not be watching mobile all throughout the day or laptop throughout the day. You should after 10 p.m. or you should stop watching mobile. You make some time for playing or whatever you like watching movie or some sort of relaxation is always there needed to have a healthy balance of mind. So you need to, and you need to have some friends also, so that you can smile with them, and those things are also required. So these are the things besides
Yeah.
having blood tests. Yeah.
Gee. So Jaising is 23-year-old male. And what are the symptoms of hormonal imbalance in men? This
Like
is
we need to screen, no, otherwise we can't tell you whether first thing is clinical examination. If we found like something, the clinical abnormality like swelling in the neck, uh, goiter is there or not, thyroid swelling is there. Some patients complain of infection in the private part because of the high blood sugar. In that way the diabetes is detected also. So these are the things, recurrent UTI, menstrual irregularities, not having children during reproductive age group. So these are the things you need to evaluate, not gaining weight properly, gaining too much of weight. So when you find a clinical clue, then you go for further tests and then you consult your doctor. Then he will guide you properly.
तो सर जो मेन एंड वीमेन में अगर हार्मोनल इम्बैलेंस के बारे में बोलते हैं, रिप्रोडक्टरी हेल्थ या सेक्सुअल हेल्थ में अलग अलग प्रॉब्लम्स हो सकते हैं, तो ये आप दो तीन
हाँ जी।
बार बता चुके हैं अब तक। तो जरा वो कैन वी प्लीज थ्रो सम मोर लाइट ऑन हाउ female sexual and reproductory health and male sexual and reproductory health can be impacted by hormonal imbalance?
Yeah. So basically, male sexual health is basically nowadays people complain of erectile dysfunction. So most likely because there can be some hidden cause like diabetes can be present, and the patient might have some psychiatric illness also, like is receiving antipsychotic medication. So these are the things you need to keep in mind, and you need to evaluate for that. For female, what you said, that some patients complain of less sexual arousal and other things. So we need to
Libido.
counseling, proper counseling with the partner also, and with the partner, then we can think of whether there is some issues with them also or not. Then you need to check like a blood test what I ordered you, like thyroid, sugar, and sexual hormone tests, menstrual irregularities, whether the patient is having polycystic ovary or not. You need to do an ultrasound to rule out whether there is some polycystic woman might have some hair growth over the face. This is very common nowadays. And acne, not responding to treatment. So they might require some laser treatment later on, hormonal treatment for to regularize their periods, because polycystic women usually have anovulation and they might not have fertility. So they need to have, first thing, they need to regularize their periods with contraceptive pills, and anti-androgen treatments are given, another thing. So you need to come for checkup then only.
Yeah, right. सर किसी ने टेस्टोस्टेरोन की बात पूछी थी, where is the question गायब? Sorry, just give me a sec. Certified bugs. टेस्टोस्टेरोन का क्या इम्पोर्टेंस है और कैसे इसको बढ़ाया जाए एज बढ़ते टाइम, हाउ इज इट इम्पोर्टेंट इन मेन एंड वुमेन?
Yeah, very good question. Like in menopause, male does not have an andropause. Okay. So what happens is we tell that terminology late onset hypogonadism. So with age, usually after the age of 45, like sexual hormone might decrease slightly. So you need to check twice readings of testosterone need to be done, and whether the patient, you need to have a proper drug history, whether that can cause the low testosterone or not, or so you need to rule out those things. And after that, if you find out a low testosterone on two readings, then you need to treat them. Nowadays we have testosterone replacement in the form of injection, gel, and oral tablets also. So that under proper supervision of a doctor, because androgen replacement if not adequately replaced, if over replaced, that might lead to side effects like acne, raised hemoglobin, and other things might happen. Like in nowadays, we come across patients who come from gym, and the gym trainer might prescribe them this androgen replacement to build their muscle. And these have important side effects. So they come to us. We need to stop those medications, and without doctor advice, the gym trainers should not be giving those medications. These are not to be prescribed.
Right. So I think we should talk more about it. I'm hoping that people should ask a few questions. There is another question. Dr. AK है, 60-year-old है, female है. इनका LVH, diabetes, हाइपरटेंशन, आईबीडी, ओबेसिटी है एंड मेटाबॉलिक डिसऑर्डर आइडेंटिफाई किया गया है. Is this due to female hormone imbalance? I'm in my 60s and lifestyle changes that can help. What are the hormone tests that I frequently need to do?
Yeah. Regarding your blood pressure and left ventricular hypertrophy, what you said, or you are prone to ischemic heart disease also. So, what I would suggest you first control your metabolic parameters, like you control your blood sugar, you control your blood pressure, and you control your blood cholesterol. If you control these three things and maintain your ideal body weight, 70% of the problems can be resolved. But even then, there is some risk, but which is manageable. So you need to control your blood sugar, blood pressure, and blood cholesterol for better control of your comorbidities.
जी. सो डायबिटीज का कंट्रोल जो है वो सबसे इम्पोर्टेंट बनता है. आई थिंक वी शुड ओपन अप नाउ. We've talking about thyroid and other hormones, but now when we talk about pancreas and its functions, insulin and its functions, diabetes कितना इम्पोर्टेंट है सर. एंड हार्मोनल इम्बैलेंस की वजह से ही हम लोग वहां पर लैंड होते हैं. एंड व्हाई इज इट इम्पोर्टेंट टू टेक कंट्रोल एंड टेक चार्ज ऑफ इट?
Yeah. So you know that 1 in 10 adult population is affected by diabetes nowadays, and so you can understand the gravity of the situation. Diabetes is increasing by leaps and bounds, and India and China harbor about 50% of the world diabetic population. Okay, and 50% of the people even do not know they have diabetes. So mostly in female, so they don't go for checkup. But nowadays, with the help of insurance policies and other things, they are going for checkup, and with NGO organized camp like Apollo 24/7 sometimes organized medical camp. In that we get recent diagnosis diabetic patients also. Also during thyroid screening, we get 10%, 1 in 10 adult population we get thyroid disorder also, like mild hypothyroidism or overt hypothyroidism. So we need to organize the camps and frequent sugar checkup camp and thyroid, because these are the two most common diseases: thyroid disorder and diabetes. So everybody need to be screened for that once you are above the age of 30 years, and you need to check for those things in that way.
सो दिस इज एन इम्पॉर्टेंट थिंग दैट यू सेड कि महिलाएं जो है हमारे घर में अनलेस प्रॉम्प्टेड या नहीं तो कुछ ऐसा जो स्क्रीनिंग प्रोग्राम चल रहा है तब तक उनको जाने का कभी मौका भी नहीं मिलता है, या नहीं तो ऐसा एनकरेजमेंट भी नहीं मिलता है कि चलो करवाएंगे. तो
Yeah,
screening for me, doctor, I think Apollo 24/7 has been the boon where they give me control on booking the test, consulting an expert. बहुत ही आसान हो गया है. I think technology की
yeah,
जो
yeah,
भी benefit है
yeah,
हम हमें use करना चाहिए. And also all the जो भी घर में बड़े हैं, if men or women, they should take charge of the family's health.
So
So
you must understand that health is wealth. So we spend much money in restaurant. We 3,000, 4,000 pocket money goes there, but we don't
जी.
spend 100 rupees for blood sugar check or thyroid 500 rupees. So these are the things we need to
Simple.
keep in mind. Yeah, so that's it.
Exactly, doctor. Wonderful. So, Dr. Karthik is asking this question. Male hair, 22-year-old hair. Is gray hair due to any specific hormonal imbalance?
Yeah, yeah. This is nowadays very common because gray hair, because of the poor nutrition during the childhood period, and sometimes you are genetically prone also. So you need to check your hemoglobin first, okay, and liver function disorder, whether you are having any LFT abnormality or not. You check your hemoglobin, you check your serum ferritin, and whether you are taking a proper diet or not. So these are the things, because gray hair won't go with the outside treatment. You need to have a good nutritious diet, and even then sometimes you are unable to take care of the gray hair, but you can at least maintain the luster of the hair, and you need to go for a hemoglobin checkup and ferritin, and you need to have a liver function test abnormality you need to check, and you need to have a good healthy diet. Then only you can manage your gray hair. Yeah.
So, ये जो 20 साल का बच्चा है, around 22 year old, and gray hair means that there is some kind of lack or imbalance. So, they need to
Yeah,
further
yeah,
evaluate. Yeah.
sure.
Thank you, doctor.
Nutrition aspect also, yeah.
Done, done. Yes, doctor. So, doctor, here's the next question. Muhammad Ismail is smart. स्मार्ट किचन। 2 मिनट में पूछती हूँ। वेंकट रमना रेड्डी मरिकेरी, आप स्किन के बारे में पूछ रहे हैं। బికాస్ ఆఫ్ యువర్ నేమ్ ఐ థింక్ మీరు తెలుగు మాట్లాడతారు అనుకుంటున్నాను. ఒకవేళ మీరు స్కిన్ రిలేటెడ్ క్వశ్చన్ అడుగుతున్నట్టయితే నెక్స్ట్ వీక్ మేము స్పెసిఫిక్ గా స్కిన్ స్పెషలిస్ట్ తో మాట్లాడుతున్నాం. ప్లీజ్ కమ్ బ్యాక్ నెక్స్ట్
Yes.
వీక్ ఫర్ దిస్ క్వశ్चन. टुडे विल नॉट बी एबल टू टेक दैट क्वेश्चन. थैंक यू. मोहम्मद इस्माइल जी का क्वेश्चन है, इनका शायद फीमेल के बारे में क्वेश्चन पूछ रहे हैं. 36-year-old फीमेल, थायराइड है और एंडोमेट्रियल थिकनेस 27 mm है. आर दीज रिलेटेड?
Yeah, hypothyroidism patient might have endometrial thickness elevated, and they might have a menstrual irregularities also. So you need to get treated with thyroid hormone replacement and maintain the blood level in the normal range. Even then, the endometrial thickness persists. Then you might have a gynecological issue like dysfunctional uterine bleeding or fibroid, and you need to consult your gynecologist also.
ओके, थैंक यू डॉक्टर. सो ये बहुत ही इम्पोर्टेंट बात है सर कि जो जब वुमेन देन व्हेन दे प्रोड्यूस विद दीज सिम्टम्स, पीसीओडी बोलिए या अदर मेटाबॉलिक डिसऑर्डर्स के साथ रेप्रोडक्टरी जो होते हैं, तो एंडोक्रिनोलॉजिस्ट के पास जाना है या गायनेकोलॉजिस्ट के साथ जाना है या दोनों के साथ?
If you go with the medical part, then you consult the endocrinologist first. And if the endocrinologist think that both can manage the thing, but polycystic ovary and this endometrial thickness part, or if she is having regular periods, then first thing she should have a metabolic clearance, like metabolic abnormalities should be corrected. Anything like diabetes, thyroid, hemoglobin,
जी.
other things should get corrected. And even then the problem persists, and if there is some tumor or like dysfunctional uterine bleeding, then she need to consult a gynecologist.
सो दोनों का जरूरत पड़ेगा एंड सबका कंसल्टेशन लेना पड़ेगा.
Well, yeah,
थैंक यू
it's a
सर.
teamwork. It's a teamwork.
Right. So next is Prashanta Das ka question. 25-year-old male hai. I have higher level of triglycerides, around 350 plus, and also suffering from insomnia from last 6 months. I do also have skin problems like pimples on the body. तो ये metabolic disorder हो सकता है सर?
Yeah, yeah. So high triglyceride. What about his LDL level? LDL is normal or no abnormal? LDL level, whether he has taken
Prashanta
something.
ji, will you quickly type down your LDL number? That will be helpful.
Whether it is raised or not.
LDL, HDL, VLDL अगर आपके हाथ में है तो प्लीज
Only
टाइप
LDL
कीजिए.
will do. Only LDL will do.
Only LDL
Only.
भेज दीजिए प्लीज. Yes, I'll wait for him to type down his
Yeah.
answer, doctor. In the meanwhile,
We can come
if you
back.
can, yeah, we can come back to that
Yeah,
question.
but I
But
can quickly
generally,
answer his. I can
yeah,
quickly answer his question also. The
जी.
thing is that first thing, whenever you get a high triglyceride, first thing you consult regarding his diet, whether he's taking too much of carbohydrate. Okay, if too much of
LDL is high,
carbohydrate,
sir.
LDL is also high. Okay. So he has a mixed dyslipidemia. Like mixed dyslipidemia is a condition where LDL is also high and triglyceride is also high. So you need to check the background illness, like whether he is a diabetic or not. Okay. And whether he's having too much of carbohydrate in his diet, whether he's actively exercising or not. In spite because his values are high, so if the blood sugar is under control, then he will
But he's a
require some.
young person. You know what happens is most of the time these young people think that they're fine, and then suddenly
Yeah.
these test reports show them that they're not. So
They
that's the
they are at
confusion.
risk of premature coronary artery disease, also heart attack. So
Oh,
if they don't control the, because nowadays we are getting heart attack at a young age. As you know, Indians are prone to diabetes a decade earlier as compared to Western population, and also
yeah.
heart disease also occurs a decade earlier. That means if in Western countries the heart attack occurs at the age of 50 years, Indians are prone to develop heart attack at the age of 40 years. Okay, so we, because of our genetic predisposition, we have a higher risk of heart disease. We have a higher risk of diabetes. So we need to have a more frequent screening at a young age. And because this person is having high female, no, you said female or male?
No sir, male है sir, 25-year-old है. उनका
Yeah,
LDL के साथ सब high है. All lipid profile
yeah,
is
yeah, yeah.
higher values.
So, yeah, yeah.
Father is diabetic.
Okay, so you need to check his blood sugar. And if the blood sugar is under control, he need to have a less carbohydrate in his diet, less fried item, and do regular exercise. And he will require some sort of medication to lower his lipids. So he will require,
Okay,
and
so
whether he takes
ऐसे
alcohol or not, because alcohol will also increase triglyceride level. Yeah.
राइट सर, तो ऐसे एज ग्रुप में अगर इमीडिएटली पता चल गया है, इनको गेटवे में पता चल गया है कि थोड़ा डिसलिपिडीमिया है एंड दे नीड टू कंट्रोल, तो यहाँ से उनको क्या करना चाहिए, कब कब उनको क्या क्या पैरामीटर्स चेक करते रहना चाहिए, और किनके साथ उनको रिश्ता, डॉक्टर्स में किनके साथ उनका रिश्ता बनाए रखना है?
Sure. So first thing is risk scoring system. First thing we need to know whether the father had a coronary artery disease or not, premature coronary artery disease or not, or whether you say, as you said, one risk factor is their father is a diabetic. Okay. So
जी
he need to maintain a good diet and lifestyle, and he need to take the dyslipidemic medication, and also he need to check blood lipid profile first every month for first month, and then every 3 to 6 month interval he need to check his lipid profile. He can consult a cardiologist also. He can consult an endocrinologist also. So that is how he can consult a internist also, like general physician also, who are capable of treating this kind of illness. So
Wonderful, sir. So Apollo 24/7, I think, brings everything together for you, Prashanta Das ji. You're very young and we want you to take care of your health. Please go ahead, circle member बन जाइए. लैब टेस्ट से लेकर मेडिकल से लेकर आपके कंसल्ट्स तक, all your records will be in one place. I tell you how easy it is to have test reports in your locker, and also diabetes management, lipidemia management बहुत easy हो जाता है. Yeah. So
one
next
thing more,
question.
one thing more, one thing
जी
more.
जी.
And he need to keep triglyceride below 150, and LDL should be below 100 to maintain to reduce the risk of heart disease. Yeah.
एब्सोल्युटली सर, ये पैरामीटर्स
Yeah.
आप लिख के लगा लीजिए एंड कीप चेकिंग योरसेल्फ, बार बार चेक करते रहिएगा. डन
Until the
सर.
target is achieved, he should be consulting his doctor frequently. Yeah.
डन डन. सर नेक्स्ट क्वेश्चन लेती हूँ मिलिंद लोखंडे जी का. सर इनके इनका एज है 41 ईयर ओल्ड है, 115 किलोस का वेट है इनका, और हाइट है 172 सेंटीमीटर्स, नॉन डायबिटिक है, बीपी है, स्लीप एपनिया है, पेट दर्द भी है, किडनी में स्टोन है, और अभी रोमेटाइड की वजह से चलने फिरने का दिक्कत भी हो रहा है, घुटने के नीचे खुद शक्तिहीन महसूस करता हूँ, और नीचे बैठ नहीं सकता, अगर बैठे भी जाता हूँ तो खुद खड़ा नहीं हो सकता हूँ. 40 साल के है सर ये.
He's a diabetic also, you said, no?
नो सर,
He's
नो
diabetic
डायबिटीज,
also.
बीपी है सर, नॉन डायबिटिक बीपी है.
So what is his question?
सर
What he wants to
तो
know?
हाँ जी, आप मिलन जी, आप रोमेटॉइड आर्थराइटिस के बारे में पूछना चाहते हैं या क्या पूछना चाहते हैं? सही घुटनों का दर्द के बारे में पूछना चाहते हैं, या देखती हूँ सर, आई वेट फॉर हिम, बट जनरली स्पीकिंग
Yeah, to
ऑस्टियोपोरोसिस.
reduce basically his lifestyle is hampered because of the joint pain, because he is unable to walk. The first thing he should go for is to maintain the ideal body weight. So he need to consult a proper dietitian and a doctor. So to maintain at least he should reduce the weight, because nowadays we have good medication which can reduce the body weight also with along with diet and lifestyle. So he need to at least lose 5 to 10 kg of ideal body weight, yeah, excess body weight, and then only he will be able to reduce the risk of complications and enjoy a good life. So weight loss is
जी
very important, because knee replacement won't help only unless he loses weight. So he need
जी.
to lose weight also.
सर क्या रिश्ता है मेटाबॉलिक डिसऑर्डर्स का और वेट गेन का और ओबेसिटी का? सब लोग ये पहला इजी बोल देते हैं कि मेरा थायराइड है इसलिए मैं वेट गेन कर चुका हूँ. इज थायराइड टू बी ब्लेम्ड फॉर, और इज वेट गेन टू बी ब्लेम्ड फॉर?
No, no. We have many patients who are thin and lean and thin, and they are also hypothyroid. So, and also we have diabetic patients who are lean and thin, they are also diabetic. So that everything that is not related to weight. So what mostly, yeah, hypothyroid patients and diabetic patients are obese, but that doesn't mean that lean patients and doesn't have thyroid and diabetes abnormality. So that should be clear in the mind that you need to maintain the ideal body weight, and not because even after thyroid replacement you sometimes don't lose weight too much. So you have to have a active lifestyle and reduce the intake of food. Unless you reduce the intake of food, won't lose weight, and and do regular exercise to maintain that lost weight. So it will be difficult for you to maintain an ideal body weight.
So I was in a very long time condition that because of the slow metabolism that I have thyroid, that I'm unable to lose weight. इतना करती हूँ फिर भी मेरा weight घटता नहीं है और
Hmm.
एकदम stuck हो गई थी. Especially when I was in my early 30s, I was struggling a lot to lose weight with thyroid, and I was blaming my thyroid for it. Then later, right medication and right exercise and consistency helped me to get back to normal.
Yes,
तो ये
absolutely.
ब्लेम गेम तब तक चलता रहेगा सर, एंड राइट सपोर्ट भी इम्पोर्टेंट है.
So this kind of program is required very much to create awareness, and people should join always this kind of program to make themselves aware of the issues, because there are many sites which provide wrong information that आप ये खाइए तो weight loss हो जाएगा, वो खाइए तो weight loss हो जाएगा. वैसा होता नहीं है. Basically you have to have an active diet and lifestyle, then only it will help.
जी. जी. सो इवन विथ थायराइड, अगर आपका थायराइड करेक्ट होता है, सो कैन बी अश्योर दैट वेट लॉस कैन हैपन व्हेन यू करेक्ट योर हाइपोथायरॉयडिज्म.
Yeah, initially you might lose 1 or 2 kg or 3 kg if you are overweight, like edematous and other thing. But because correcting thyroid disorder will motivate you, you will become metabolically active, and you will feel less lethargic. And if you use this kind of benefits to your exercise also, then you will get motivated also. The first thing is motivation is required, that you want to maintain an ideal body weight. Nobody will help you unless you yourself are motivated. So you need to be get motivated. That's it.
जी.
So one
सो
or two
नेक्स्ट
kg
क्वेश्चन.
might be you might
या.
lose, but losing too much weight, because there is a wrong notion also. Sometimes those patients who are not hypothyroid, only obese, they take sometimes thyroid medication. We see many prescriptions from the periphery also, that the patients not hypothyroid, even then they are getting thyroid medication to lose weight. So that has side effects also. That puts stress on the bone, stress on the heart. So you might land into soup also. So you need to keep in mind.
ठीक है. So next question is Sunny Kumar, 38-year-old male. Does thyroid medication in the long run cause multiple organ disorders? Is there any way to make thyroid normal naturally?
Naturally, okay. 95% of the patients usually require thyroid hormone replacement. Some drug induced or like thyroiditis patient, 4 to 5% patient might not require thyroid hormone replacement. With regarding the side effect of thyroid hormone medication, if you adequately replace, if you maintain the TSH, T3, T4 within the normal range, then there are no side effects. But if you don't go for frequent monitoring, and if you are over treated, then it will put stress on your heart. As I said, it will put stress on your bones also, and you can have osteoporosis also. And if you are not adequately replaced, then you will not feel symptomatic free also. So you will still having, so both inadequate and over replacement are hazardous. So you need to maintain the hormonal level within the normal range with your medication. And first thing you should remember that this thyroid hormone is not a medication. You are getting a hormone replacement, which is deficient in your body, and you are getting replaced from outside. So the natural way, some sort of yogas and other exercise like turmeric powder we see in net also. This might help in mild hypothyroidism, but not in when you are over hypothyroidism. It might not help. So along with medication, you can do all those sorts of exercise, but don't stop taking medication without doctor's advice.
Great. So next question is Gurudeep, male has a 29-year-old hair. I've noticed gray hair in my adolescence and it still continues now. All hormone tests are normal. Can gray hair be reversed at this age and stage?
I say I've already taken this question, but even then, if you said that your metabolic abnormalities are normal, So sometimes it's very difficult, but one medication I have heard that spirulina might help. So you can try that medication if it helps. I don't know, but
Yeah.
basically there is no good treatment for gray hair. Yeah, unless there is some
जी.
metabolic abnormality.
हाँ जी. So, डॉक्टर शॉन डेविड जी पूछ रहे हैं कि hypertension and diabetes are supposed to be known as twins. What are the precautions to take care and manage these both?
So yeah, again, very important thing. You all know that diabetes and hypertension are silent killer disease. Silent killer means they don't have any symptom and you don't get treated. Patient बोलते हैं कि हमको तो अभी कोई symptom नहीं है भाई अभी हम दवाई क्यों लेंगे. तो वो चीज के चलते क्या हो रहा है कि धीरे धीरे माइक्रोसेलुलर लेवल में ऑर्गन डैमेज होते रहता है. तो अगर और 50% पेशेंट्स को तो मालूम भी नहीं रहता है कि इनको ब्लड प्रेशर है या शुगर है, तो वो लोग चेकअप भी नहीं करते हैं. और जिनको है ब्लड प्रेशर उसमें 30% ही रेगुलर मेडिकेशन लेते हैं, 70% रेगुलर मेडिकेशन भी नहीं लेते हैं और ना चेकअप में जाते हैं. तो वो चीज़ जो इंश्योर करना है, एक तो ब्लड प्रेशर शुगर आप रेगुलर चेकअप कराएं मैंने आफ्टर द एज ऑफ 30 एटलीस्ट. एंड अगर एबनॉर्मलिटी आता है तो मेडिकेशन रेगुलर लें, दवाई रेगुलर खाएं, रेगुलर चेकअप में रहें. इससे आप मतलब बहुत लंबे और मैंने लंबे समय तक आप स्वस्थ रह सकते हैं. Otherwise, there will be some issues. So you need to continue the medication on doctor's advice. Go for at least annual checkup, not 6 monthly, 3 monthly. Then at least annual checkup should be there, and you should continue the medication as advised by the doctor. और medication लेने से कोई नुकसान नहीं होता है, लेट शुरू करने से नुकसान होता है. तो ये बात.
जी, जी. Right, sir. So next question is Mr. Dharmendra Kumar, 38-year-old, male है, BMI 23, TSH is 11, taking 37.5 medicine, VID 49, testosterone is 550, following a good lifestyle. I still can't run and I'm not feeling energetic as of now. What should I do to feel energetic?
So yeah. फर्स्ट थिंग ये जो इन्होंने कहा टीएसएच अभी भी रेज्ड है 37.5 लेते हुए, तो ही
Hmm.
शुड इंक्रीज द
The
डोज ऑन
TSH
डॉक्टर
11 है.
एडवाइस. 11
11.
होता है, वो भी ज्यादा है. हाँ, above 5 is an abnormal, no? So above 5 is abnormal, so his TSH is raised. So he should consult his doctor and ask where he will increase the dose of thyroid medication if he is regular with the medication. First thing we need to know if this report is with regular medication or with irregular medication, whether patient is having regular medication
Hmm.
or not.
Hmm.
So that is very important before increasing the dose. So one must know. And regarding the lack of energy, he might require some multivitamin supplement that might help him. Yeah.
So that's it. So you just have to continue your, as आपने कहा है कि lifestyle modification भी आपने किया है, बस patience रखिएगा, continue with your medication, monitor कीजिए, and also multivitamins and supplements अगर चाहिए तो आपके physician की help से ले लीजिएगा. That's a simple thing, धर्मेंद्र जी. Next is yeah, sir, इनका फिर वापस ये मैसेज है कि धर्मेंद्र कुमार जी का TSH up and down होता है even after taking and proper medicine. What may be the reason?
हाँ, नहीं ठीक है. तो बेसिकली डॉक्टर से मैंने दिखाना चाहिए इनको कि क्योंकि कब लास्ट डॉक्टर को दिखाया मेरे को मालूम नहीं है. और डॉक्टर भी बहुत फ्रिक्वेंटली डोज चेंज नहीं करना चाहिए. और मैंने एवरी और कोई भी ब्लड टेस्ट जब आप डोज बढ़ाते हैं तो एटलीस्ट यू शुड वेट फॉर 4 वीक्स टू सी वेदर द डोज हैज सेटल्ड और नॉट. सो क्या होता है, आज अगर बढ़ाएं और एक सप्ताह बाद अगर हम ब्लड टेस्ट करेंगे तो वो रिपोर्ट एबनॉर्मल आएगा. तो एटलीस्ट हार्मोन में क्या होता है, स्लो टू एक्ट. तो एटलीस्ट यू शुड गिव अ 4 वीक्स टाइम टू सेटल द डोज एंड देन यू गो फॉर चेकअप. And then if the TSS is still high or low, then you need to modulate the dose according to the doctor's advice.
सर आपने बहुत ही इम्पोर्टेंट क्वेश्चन का दरवाजा खोल दिया है कि कब टेस्ट करना है. रम्या नागराज का क्वेश्चन के साथ मैं ये कंटिन्यू करूंगी सर. थायराइड का डोज कैसे डिसाइड किया जाता है? आई एम टेकिंग 100 mcg डेली बट इट वाज reduced to 25 mcg and then it went to 150 mcg. Now I'm taking 125 3 days. So what are the tests? When should I get the tests done? When should one understand कि जैसे अभी बोला है कि फ्रीक्वेंसी कब है, तो डोज लेने के बाद टेस्ट करना है या पहले करना है?
हाँ, फर्स्ट थिंग तो जैसे इनका जो चर्चा है वो भी एक डॉक्टर की गड़बड़ी से भी होता है कभी कभी। क्या होता है कि आप डॉक्टर के पास गए, आप 50 mcg अगर आप ले रहे हैं, समझ लीजिए आप ही ले रहे हैं 50 mcg, आप डॉक्टर के पास गए, आप बोलेंगे डॉक्टर सर रिपोर्ट नॉर्मल है, तो व्हाट द जनरल फिजिशियन यूजुअली डू, दे स्टॉप द मेडिकेशन एंड नेक्स्ट मंथ यू डू द टेस्ट अगेन, इट विल रोलर कोस्टर इफेक्ट, द टीएसएच मूव्स अप। तो report normal means you don't need to stop the drug, you need to continue the same dose, means your doctor has given the adequate dose of the medication. But what happens, a general practitioner or a other doctor, like a doctor from other stream or some family doctor says आपका रिपोर्ट नॉर्मल हो गया, आप दवाई बंद कर दीजिए, तो वो बंद कर देते हैं, तो इसलिए उनका डोज फ्लक्चुएट करता है। तो ये चीज भी ध्यान में रखना है। और फिर अगर आप जैसे कोई दवाई ले रहे हैं ऑलरेडी, तो जैसे मैंने कहा कि आपका अगर डोज फिक्स है, जैसे आप अपना ही बता रहे थे कि आप साल में या 6 महीने या 8 महीने में एक बार चेक करते हैं, तो उसका मतलब यही है कि आपका डोज फिक्स हो गया है, तो अभी आप साल में भी एक बार चेक करते हैं तो चलता है। लेकिन जो पेशेंट का जैसे प्रेगनेंसी में मैंने एक एग्जांपल दिया था आपको, या कोई ओवरवेट हो रहा है, और यार अभी जैसे आज 25 से मैंने आज आपका डोज 50 कर दिया, जैसे इनका टीएसएच 11 था, तो 37.5 से मैंने 50 किया, तो आई शुड वेट एटलीस्ट फॉर 4 वीक। उसके बाद अगर ये रिपोर्ट नॉर्मल आता है, तो वी शुड नॉट चेंज द डोज ऑफ द मेडिकेशन and he will continue the same dose for, and then again you check for after 6 months, again the report comes normal, you continue the same dose। दवाई कब बंद करना रहता है या कम करना रहता है, जब आपका टीएसएच बिलो नॉर्मल चले जाए, T3 T4 ऊपर चले जाए नॉर्मल वैल्यू से, then you need to reduce the dose of the drug, otherwise if the reports are normal you continue the same dose।
Right. So it is important to keep a track of your hormonal imbalances. Any sign that you have, any test, any thyroid ही नहीं, diabetes भी इतना ही important है कि आप टेस्ट करते रहिए, आपके वैल्यूज क्या नॉर्मल है, कौन से मेडिकेशन पे कितना है, दैट्स आल्सो important. In the same regard, I would want to take Mr. Sean David's question again, जो पूछते हैं मेटफॉर्मिन लॉन्ग रन में प्रॉब्लम है क्या?
नहीं, मेटफॉर्मिन इज अ वंडरफुल ड्रग इन द मैनेजमेंट ऑफ डायबिटीज। ये नॉन डायबिटिक को भी दिया जाता है, फॉर योर इंफॉर्मेशन, जैसे पॉलीसिस्टिक ओवरी डिजीज है किसी को, तो वो पॉलीसिस्टिक फीमेल लोग को भी दिया जाता है टू रेगुलराइज द पीरियड्स एंड वेट गेन। एंड ऑल्सो यू मस्ट रिमेंबर दैट कि मेटफॉर्मिन का वेट लॉस का भी एक इम्पैक्ट है। प्री डायबिटीज पेशेंट को भी हम लोग देते हैं ताकि वो प्री डायबिटीज से डायबिटीज नहीं हो जाए। और फिर मेटफॉर्मिन कोलेस्ट्रॉल को कम करता है, कैंसर रिस्क को कम करता है, वेट नहीं बढ़ने देता है, ये पीरियड्स को रेगुलराइज करता है। तो मेटफॉर्मिन अनलेस कोई जीआई साइड इफेक्ट जैसे नौसिया वॉमिटिंग अगर नहीं हो रहा है, तो डोज को कम करने का दरकार नहीं है। और मेटफॉर्मिन का मेजर कोई साइड इफेक्ट नहीं है, बिकॉज इट डज नॉट इटसेल्फ डजंट कॉज हाइपोग्लाइसीमिया, तो लो ब्लड शुगर तो करेगा नहीं खाली मेटफॉर्मिन अगर आप ले रहे हैं, तो इसलिए। और आपका वेट भी मेंटेन रहता है। तो मेटफॉर्मिन का unless you have a GI side effect like nausea, vomiting on taking medication, then only you need to reduce, otherwise ऐसा कोई side effect नहीं है। In fact it is a wonderful drug।
Wonderful. Thank you, sir. Thank you so much. Yeah, sir. One quick question before we wrap up for the session. Komal Sahu, 22-year-old female. I feel. Would you like to have a sip of water, doctor, if you have them, by the way? Yeah. Yeah, I'll read out the question in the meantime. Komal Sahu is 22-year-old female. She feels tired each time after eating a good meal or even waking up after a nap. Why is this so?
Can you please repeat the question, ma'am?
Yes, sir. Sir, Komal Sahu 22-year-old है, female है. I feel tired after waking up and after eating a good meal also. Why is this so?
So you must be taking too much of carbohydrate in your diet. So you need to reduce the carbohydrate. You need to increase your protein intake. So that you will suppose sometimes what happens after a lunch meal when we are driving, sometimes we have a nap. So because we take too much of carbohydrate, no. So you need to reduce your carbohydrate intake and slightly increase your protein intake, and don't overeat. Keep your stomach slightly empty, and that will take care of your problem. Yeah.
Ji, ji. Um, one last question. I keep saying last question, but one last question, doctor. Ravi Patnaik ji पूछते हैं, female है, 66-year-old है, height 5'4", 78 kilos weight, thyroxine 100 mcg लेते हैं, BP is controlled by Telma, non-diabetic, hemoglobin है 9.75, वेट रिड्यूस नहीं हो रहा है, इनका रीजन क्या हो सकता है और क्या कर सकते हैं?
एक तो हेमोग्लोबिन को करेक्ट करिए, वो हेमोग्लोबिन कम है उनका, तो हेमोग्लोबिन करेक्ट करें. और nowadays we have like dietary supplements also, because to follow a diet is very difficult nowadays. So if you have a dietary supplement like meal replacement formulas, what we tell, and studies have shown that compliance is better with meal replacement formula as compared to dietary regulation. So अगर आप 2 scoop twice a day कोई भी एक अच्छे कंपनी का मील रिप्लेसमेंट फॉर्मूला with high in protein and less in carbohydrate and high in fiber, that will provide satiety to you, and also you will feel less hungry, and you will be able to maintain ideal body weight. So I think you can start this meal replacement formula and do some sort of exercise regularly, and that will help you to maintain the body weight.
Thank you, sir. Thank you so much. You've been extremely patient. So, to conclude this session, I would want you to reiterate what we've been talking about and the tips to take care of any hormonal imbalances. Gateway to our health क्या है और क्या क्या हमें monitor करना चाहिए और कब कैसे करना चाहिए. Top tips from you, sir.
Yeah. So top tips is basically we should go for a regular blood checkup, and basically checkup should include this hemoglobin, sugar, and thyroid at least. And if you are above the age of 40, at least you should check lipid profile also. And if you want to add one more test, you can add uric acid also. So these are the few tests you need to do frequently. Once you start growing up, after the age of 30, it is always essential. And once your doctor advise some medication, you need to comply with those medication, go for a regular checkup, and have adequate sleep, good diet, nutritious diet, and lifestyle. Do some sort of exercise, whatever you like, and this will help you maintaining a good health. That's it.
Ji. Thank you, sir. Thank you so much for participating with us on this Sunday morning, and we appreciate your generous time. Thank you, sir. राइट एंड अभी मैं क्विज क्वेश्चंस पूछने जा रही हूँ. हेल्थ आर में हेल्थ क्विज आने वाला है. आई एम गोइंग टू आस्क यू 3 questions. You have to answer your questions on YouTube chat only. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And winners, you have to mail your contact details with name, the phone number which has Apollo 24/7 downloaded, and you have to email this before Wednesday. If you have not responded before Wednesday, we will not be able to take your claim. So please do write back to us with your contact details at marketing@apollo247.com to claim your prizes. Gift vouchers will be shared with you, and you can also check अगर आपका नाम दिया गया है और किसे कहाँ मेल करना है, हम चैट बॉक्स में भी डाल के छोड़ेंगे आपके लिए. सो आज के क्वेश्चंस यहाँ पर है, आपके स्क्रीन पे डालेंगे. प्लीज चेक दीज क्वेश्चंस ऑन योर स्क्रीन. द फर्स्ट क्वेश्चन, फिल इन द ब्लैंक्स. एवरी ऑर्गन इन आवर बॉडी इज रेगुलेटेड बाय. एच से शुरू होता है वर्ड. एच ब्लैंक आर ब्लैंक ओ ब्लैंक ई एस. क्या है आज का टॉपिक? वही है. दैट्स द बिग क्लू दैट आई हैव गिवन यू. क्वेश्चन नंबर 2, ट्रू और फॉल्स में आंसर कीजिए. Hormonal imbalances occur when there is too much or too little of a hormone presence in the body. I repeat the question. Question number 2, true or false में answer कीजिए. Hormonal imbalances occur when there is too much or too little of hormone presence in our body. Question number 3, yes or no में answer कीजिए. Females are likely to develop different hormonal imbalance disorders than males. Is that correct? Yes or no में type कीजिए. These are the questions for today. And while you are answering your questions, I'm going to give away gift coupons for you. This is the first one that I'm giving away is Ask Doc 150. ASKDOC 150. Use this code on Apollo 24/7 to consult top doctors direct from Apollo and get 150 rupees cash back on online doctor consultation. And the next one is code FIRST3, FIRST3. You get up to 25% off on online medicine orders. You can order medicines direct from Apollo and get a 2-hour delivery as well. The next one is exclusively for our Health Hour viewers. Use the code HH247 to get 199 off on online consultation with Apollo doctors and 20% off on medicine orders as well. and this is in addition to the other coupons that we give away. And Apollo 24/7 now can be accessed on WhatsApp as well. Simple, जैसे आप WhatsApp text करते हो या call करते हो, आप ये नंबर सेव कर लीजिए 09355247247 एंड WhatsApp पे ये सेव करके आप पूरे हेल्थ केयर सर्विसेज WhatsApp पे भी अवेल कर सकते हो. Next week, by the way, we are talking about a very important topic, which is skin allergies. Signs क्या है, diagnosis क्या है, treatment क्या है. A lot of people do keep asking us for skin allergies and skin problems. Please do join us next week, 11 a.m. on Apollo 24/7's YouTube channel or Facebook or Instagram as well. We are available on all platforms. And I see a lot of people are typing Kanupriya, Tajinder, Pradyuman, Tekeshwar, Vinay, okay, Gurkirat, Ajay, Pradyuman, Prashanta, all of you are typing, but I'm waiting for my team to, and here are the winners for this week. Vinay, Prashanta Das and Manish Sharma. Vinay, Prashanta Das, Manish Sharma, you are the winners for this week's health quiz. You got to write back to us in an email with your name, phone number, contact address to marketing@apollo247.com. The details are also in the chat box. Please check and write back to us. All the best to all of you and thank you. Please do take care of yourselves. Namaskar. फिर मिलते हैं.